Hello, everyone. This is Vance here. That's right. Thank you for joining with me at Coffee with Vance. As usual, let me just have my cup of coffee first. Actually, to be very honest with you, I got very addicted with coffee over the past 2 months. Just been drinking lots of coffee. But yes, with no sugar, we have the black coffee. Yeah, but sometimes milk comes in as well. All right, but that's aside. Um, yes, today. I mean, if you have followed a copy events over the past few months, there's a lot of professionals who came and spoke about in terms of health, in terms of fitness, in terms of motivational, in terms of confidence, communication. So many topics that we shared. But today, I'm going to bring on board a doctor as well, and he's going to talk to us a lot of obesity, the food that we eat, and we're going to have a lot of great discussion because I had a great discussion with him a couple of days back, and we agreed to do this live streaming and benefit as many people as possible. So without any ado, I'm going to bring in Dr. Kiru. So let's bring in Dr. Kiru. Hello,
Hello,
doctor.
hi, Nance.
How are you today?
Oh, fine, thank you. I'm doing great. Your coffee looks wonderful.
But you didn't have any coffee with you.
No, unfortunately,
Okay.
I'm cutting down my coffee events. I think I already had about 4 or 5 cups throughout the day.
Oh,
So
oh,
I just had a cup
okay.
of tea, and I think it's good for me to stay away from coffee for a while.
I guess you need the dopamine to keep you awake throughout the day, right? I mean, you
Yeah,
work
yeah, yeah. Caffeine,
after.
caffeine, Vance.
Okay. Thank you,
Yeah,
Doctor, for joining today at Kopi Events. I really blessed to have you in Kopi Events show. And
yes.
today the topic is going to be what bariatric surgery is all about. But we before we even go into the topic and break it down into different segments to understand about obesity, we're also living in a current situation where COVID-19 is giving a lot of issues as well. People are overeating, stress eating, binge eating, so many things happening.
Yeah.
That also been causing a lot of weight gain and increases into a lot of other illnesses as well. But before we even jump into topics, maybe I'll leave the honor to you to do an introduction, Doctor, about
Yeah.
yourself.
Thank you so much, Vance. Again, it's a great honor to be here. And I like your concept of getting professionals from around the region and interviewing us to get our input and so on. So I find it is a fantastic collaboration between Singapore and Malaysia, and I think both our viewers will benefit from today's topic as well. As for me, Vance, actually I'm a surgeon, and I've been practicing medicine for the last 20 years. I was a surgeon 12 years ago. I started my career in general surgery, and subsequently I subspecialized in breast and endocrine. And along the way, because of endocrine surgery is actually branches out into multiple fields, and one of it was bariatrics. And so I looked into that, and I especially trained in bariatric surgery in Taiwan in 2013. And after finishing, I came back to Malaysia. Of course, my fellowship was sponsored by the Ministry of Health, Malaysia. And upon returning, I worked in Hospital Kuala Lumpur for 6 months for my gazettement, and I was transferred to start off the services in the state of Perak, in Ipoh. Have you been to Ipoh, Vance?
Oh yes, I love Malaysia. I come there very often for businesses and associates as well. So I'll be
Fantastic.
meeting you soon also after the COVID-19.
Yeah. So just last year, I left for private practice, and currently I'm based in Penang. So you have to come to Penang as well. There's a direct
Yes,
flight from Singapore
I
to
know
Penang.
there's a lot of great local dishes, right? Is it Penang laksa or Penang? What's that,
Or,
Doctor? What's famous in Penang?
they have everything, lah. I mean, the food here is a food heaven. You have nasi
Okay,
kandar, and you
okay,
have Penang char kway teow, and
okay.
as you said, Penang laksa. The food is in Malaysia. I think the food is heaven.
Okay.
So that's a bit of a contribution to our topic today as well.
Yes,
Why
yes, we did, we did.
and so yeah, it's really fun to be here. And I understand, Vance, that you are actually into fitness as well.
Oh yes, doctor. I mean, I run a local company here in Singapore. It's called Fitness Mantra, where we do a very holistic approach. Not only just gymming.
Yeah.
So you actually see it's involved in meditation, involved in communication, anything to enhance the performance of a human. That's where I am right now. So that's a different perspective that I took over the past 20 years in my fitness career.
Yeah, excellent. I think it's a holistic approach is the way to go. In fact, even in medical also, we are talking about multidisciplinary approach with dietitian, fitness trainer, and to enhance the individual from all aspects, spiritual, mental, physical, emotional, and so on as well.
That's right, Doctor. Thank you so much, Doctor, for that short introduction. We have already few viewers that's already saying good evening to us, and thank you for all the comments that keep on coming in. Thank you. So far, it's only girls, so looks like we are popular among girls. Oops. My wife is hearing, and your wife also is hearing. So yeah, so, hey,
Yeah,
your friends as well, right?
yeah. Good point.
Thank you. So, I mean, there are so many people are coming on board. Thank you for viewing us. I mean, staying tuned for us, and it's a great topic today with Doctor. Doctor, so before we even jump into the topic, I mean, obesity is the main. I would say not say I don't want to use the word killer, but the main indicator, for a lot of other illnesses that's come along: cholesterol, atherosclerosis, diabetes, so and so forth, cancers as well. So maybe we just want to talk on a little bit on the obesity numbers between Singapore and Malaysia, and then we can jump into the surgery part, and we can even dive even more deeper as well.
Yeah, fantastic, Vance. Actually, if you look at the word obesity itself, it actually is derived from the word obsius, which is in Latin, and it actually means to eat in excess, actually. And you cannot be further from the truth, regarding to the problem of obesity that is happening now, the obesity epidemic. We like to look at it very simple and say that it's a problem of eating too much, consuming too much of food and so on, and of course exercising too little or working out too little compared to sun. Now, the reason why that concept was there was because they used to follow this thermodynamics, the rule of energy, thermodynamics. Okay. So energy in equals to energy out. Okay, but that is perfect in when there's no loss of energy to anything, in a perfect machine, But a human being is not a perfect machine. We are biological specimens. So there's a lot of caveats in between. Whatever you eat doesn't mean that amount is enough for you to run your daily activity. You have energy expenditure, which can amount to about 2,500 to even 3,000 calories, depends. And currently, if a person is weighing about almost 60 to 70 kilos overweight, you're talking about energy expenditure that's about 4,000 kilocalories. So it's a lot. So when we talk about obesity and in its own context and how it's happening now, it's multifactorial. There's a lot of things that is contributing. One, of course, is being the environment. And the environment driver for obesity is because of, as we said just now, there's a lot of food that is available. And food is, of course, something that is we all love and we consume in excess. But it's not the only cause. It's an interaction between what we eat as well as the genetic factor that we are made of, the environmental factors and so on. And of course, our sedentary lifestyle as well. So because of all of this is driving the obesity epidemic forward. And to keep it very simple, Vance, it's our lifestyle basically that is causing this problem to actually multiply.
Yeah. But I got to say this, Doctor. I mean, see, we just talked about Penang, the food. Even in Singapore, we have all kind of cuisine in Singapore, right? Different cultures. So we all love food. I mean, human beings, we love food, right? Yeah. But we also, that also comes along with tons of carbohydrates, tons of sugar. And we know that any energy that is not being utilized, or like we just talked about, dietary intake or dietary out, your input versus your output, and your metabolism rate is low. And that actually causes a lot of weight gain over the period of years. Maybe say in a scale of 10 years, you might notice that the person might put on like 20 or 30 kg. And by then he is already diagnosed with type 2 diabetes, and also the blood pressure can be in stage 2, about 140 to over 80. So at that point of juncture, exercise definitely would play a part, but sometimes serious cases, that is where you are coming in. Maybe could you just explain to us, or maybe share your experiences? Why do people want to go into surgery instead of just doing it, I mean, gradually and slowly? Is there a time frame? Because I know personally that I know few people that within my circle of friends that they have went for surgery as well.
Yes.
The weight loss is tremendous. They're healthy and they start back. It's a total 360 degrees. But someone just avoid this surgery away instead of just going for the bariatric surgery, not going for that? Is that a possibility?
Okay. It is a good question, Vance. When you talk about bariatric surgery, some will feel like this is the end point, is the last resort you should choose. Okay. Some will feel like this is too extreme. Some people will say, it's just enough for you to just diet and exercise. Why bother about medication, devices, surgery, and so on? So, both of us are in the field of human performance, in getting people healthy and so on. So the first thing that we do, Vance, is that we do not judge people, right?
That's right.
We do not have prejudices because every individual is different, and we respect the choice that people make. So having said that as well, there are a lot of individuals who choose to live a lifestyle that results in them being obese, slowly developing weight over time, unhealthy diet, exercise, and so on, despite being aware. We are in a region, Malaysia, Singapore, where we're becoming more developed as we speak, and we're becoming more developed country, modern, and people are aware, they know it, but yet they choose to live their lifestyle in such a way. So I respect that, and I think you do as well. But we offer them options. So if you are into diet and exercise and that works for you, then by all means, please go ahead. But if that doesn't work for you, then you should think of the next step, what you're going to do. In fact, that's what we do. If, let's say, you're traveling from A to B and you find that you've hit a jam, or the traffic is heavy, the path is the roads are not well aware, you take a detour and you take another route. So that's what we're doing. So we advise, in a multidisciplinary, holistic approach to obesity, the next option would be to try another modality, perhaps medication, or perhaps a meal replacement, or perhaps even the intragastric balloon, and of course, perhaps even surgery. So, Vance, to put it short, you do not, I don't normally tell patients you have to follow A, B, C, D, E, and then only we do bariatric surgery. So I look at the condition, I look at the patient as a whole. We look at the comorbidities that they have. Are they suffering from diabetes, hypertension? You must understand, when you're having diabetes, some of them do not suffer because the diabetes is very early in the disease, very early in the condition. So by changing their diet and exercising, losing 5% or 10% of the body weight will improve their glycemic control and their diabetes as well. So they do not have to undergo surgery. And personally, myself as well as my team and all, we do not push any individually immediately for surgery because there's a lot of preparation and consequences involved. And we always want the patient to maximize their effort first in whatever modality they choose. And then if surgery works for them and is necessary, then we advise them that.
Doctor, you made a valid point here because I'm in the fitness and health industry for the past 20 years. There's a lot of things that constantly we need to motivate. Consistency is important. Into nutrition and a lot of big holistic and some cases over the years that I saw that some wasn't very successful because of certain things, right? Emotional stress, anxiety. I will not say it's laziness because we are nobody to judge, but I think more on the lifestyle they live, or maybe in the kind of environment that they tend to become a little more relaxed. They don't want to sweat, they don't want to go through the journey. But eventually, after a couple of years, then they realize, this is where I am right now, and they try to make that effort. It's going to be a lot of hurdles, that's for sure. But one should only consider, can I say that one should only consider surgery when they find that their blood pressure is going up to stage 3, their diabetics levels, and in terms of hyperglycemia and hypoglycemia, fluctuating, and it looks like the cholesterol level is so high. Will that be the last resort for surgery as a solution, or maybe they want to go and exercise is still a risk factor because the heart is also being under certain kind of stress? Well, the surgery will help that particular person.
Good point, Vance. If we like to look at things very objectively, right? So if, let's say, a person is already is quite ill and he's already having uncontrolled hypertension, diabetes, like you mentioned, and that is the time that he has got the eureka moment that he has to decide to do something. And that's when he goes online and checks out anything, and somehow he finds out about bariatric surgery and wants to change for the better. Of course, you're most welcome, because that is the time that maybe they would have realized that their life, they're in a crossroad. They can either go on the same way and become more worse, or go back. But Vance, I remember Jim Rohn used to say, you do not pay someone else to do your push-ups, right? You got to do your own push-ups. Yeah, and we know how hard a push-up is, by the time you're up to 20 already, you're exhausted, and then you have to do your second set, third set, So I always say, you do not wait until you reach your max point before you decide to change something. You either make the decision earlier to prevent yourself from worsening, or once that point hits in, you're already in a different situation. So a lot of them, when they are already obese and their weight is going up, but their hypertension and diabetes is still early and so on, that is the time that the danger signal is already being signaled, that you have to do something. So either you get yourself, you can meet Vance and get into a good program, or get a good dietitian to advise you and so on. Or, as I said, you can look me up and find a multidisciplinary team that gives you a holistic approach and advises you if you need surgery early in your, in that time frame, then that might be an option for you if it works well with you, of course.
Okay, doctor. So I know we have you have some slides to show us in terms of numbers, but I also have certain numbers for Singapore. I mean, with the courtesy of Singapore Ministry of Health. Maybe you want to talk about your numbers first in Malaysia. What is the obesity rate?
Sure,
what is the then maybe then go a little bit more.
Yeah, actually, Vance, I know our viewers may not be happy with statistics.
Yeah,
somehow that is a good way of putting certain figures in context, lah. So let me share my screen if you don't mind.
Okay.
Okay. I'll just bring this up. Is it okay? Are you all able to see that?
Yes, doctor, it's very clear.
Okay. So, Vance, when we talk about overweight and obesity, I always like to refer to the WHO definition of obesity, whereby we look at their BMI, which is the body mass index. If you can see over here, it's a very simple equation. Anybody can calculate. You just divide your weight, divide by your height in square in meters. And if you look at the BMI, if it's more than 30, it's considered as obese. And if it's more than 25, you're considered as overweight. And overweight and obesity, as you rightly said, Vance, is a major risk factor for a number of chronic diseases, the most common being diabetes, cardiovascular diseases, and of course, certain types of cancers. But if you look at the WHO classification, they list obesity at 30 BMI and above. What is interesting is that for us Asians of Asian descent, our obesity begins at 2.5 BMI less than 30. That is about 27.5. So we are already at overweight at BMI 23 to 27.5, meaning as our weight increases to this level, our risk for cardiovascular diseases, for cancer, for diabetes becomes significantly higher as Asians, which means that we have to be more prudent about our weight. And as you were saying just now, Vance, this slide is in Malay. Our National Health and Morbidity Survey, which is the Tinjauan Kebangsaan Kesihatan dan Morbidity, which was just released last week, shows that our diabetes from 13.4% in 2015 has increased to 18.3%, meaning 1 out of every 5 Malaysian is a diabetic now. And if you look at our kadar obesity or the obesity level, about 50% of Malaysians are in the bracket of being either overweight or obese. And you can see in this particular slide that 1 in 2 Malaysians are overweight or obese. 1 in 2 Malaysians have abdominal obesity. That means the waist circumference is more than 90 centimeter for men and more than 80 centimeter for women. And unfortunately for us, Vance, bad news for all the ladies in the house, females have the biggest proportion of obesity in Malaysia at 54.7% and abdominal circumference obesity at 64%. And Vance, even more worse, the Indians have the highest rate of obesity in Malaysia. Okay, that is 63.9% of our Indian population, Indian women especially. And the age group is between 55 and 65 years old. Okay. And as I mentioned earlier, diabetes, high blood pressure, heart disease is associated with obesity and overweight. If you look at the right-hand side, you can see that non-communicable diseases like diabetes, hypertension, and high cholesterol in Malaysia are high, with 1.7 million of the population currently living with 3 of these major risk factors, and another almost 3.5 million having 2 of these major risk factors. So as the population, as our country is becoming more modern, unfortunately, the disease is following us as well. And I think this is when we have to take action, Ready Vance. Yeah, maybe you can show us your statistics over there.
I don't have a statistics, doctor, but what happened is that there is a recent, not say recent study, but you know that it's a trend that is becoming too obvious around the world.
Yes.
Global obesity has more than doubled since 1980, and as a health professional saying that the raising, as we talked earlier about the epidemic, you know, we also having an epidemic for obesity as well, right? Because it's also a silent killer, and we talked about the BMI as well, and even we calculate the waist to hip ratio, also give you a indication where is your health is all about, and whether you start your fitness. But last year, the World Health Organization reported about 39% of adults were overweight and 13% were obese regionally. But the American top the overweight at least at 61.3%, and you know the servings are larger, you know, anything like of fries. But followed by Europeans at 58.6%, weighing at 26.8%, and 23% respectively for obese. But in Singapore, we fare a little bit better. Through that's a little consolation. In 2010, the numbers put 40% of the population as being overweight, of which is 10% obese.
14%?
So 10%. From 40% population to 10% obese.
Oh, okay, okay.
But doctor, the good thing, or I don't say the good thing, but you know, people start to exercise when they start to see the weighing scale going up. Right. So every kilogram over your ideal weight really strains your body, literally from the head to toe. Not too long back, about 2 weeks back, I was having a chat, a copy session with a doctor, Dr. Ethan H.K. Doshi. He's an orthopedic surgeon. And we totally agree, because every weight that you put on, the poor knees are taking the pressures. And your ankles, your hips. So it's, you know, if you look at the human skeletal and the muscles and the fats, the weight are just putting you so much pressure on the knees, and that not only that, doctor, because we have also the overworked heart. The heart is also overworking and crying for a little more care. How many health problems are we associated with obesity? We are talking about diabetes, cardiovascular diseases. We're talking about MI, cardiac infarction, heart attacks, strokes, and certain cancers. So it's wonder obesity is now the 5th leading risk for global death. So that's a bit scary, because as we evolve, I also see a lot of people are starting to exercise, especially during this COVID-19 period. Everybody just getting exercise, because we know that the immunity is strong. I mean, your immunity is strong, everything can be controlled. And of course, you got to be cautious. You need to take precautions. But what is your take on obesity, doctor? I mean, with good food around, and we know the numbers are increasing. In fact, this is one of the biggest virus, we should say, is obesity. But we are not paying attention to it. But food is one part, exercise is one part, lifestyle is one part. How are you going to manage this? I mean, it's easy to say, oh, I'm exercising. But for those who don't have the luxury of going to the gym, to spend that extra dollar, they might be feeling stressed, you know, like not sure what to do. Maybe they can't even have organic food in terms of brown rice. Whatever food they have, they can afford with the family, they do it. So what will be the precautions, or what can we look for? I mean, in a simpler way, doctor.
Okay, Vance, let's break it down to a few points. I think we will talk about, of course, your food diet. We'll talk about your, as you said, exercise during this COVID time as well. And maybe we can take it from there. So let's talk about food first. Okay, when we talk about food, we're talking about a situation now where our food mostly is processed. Even our raw materials, I'm not sure in Singapore events, but here we have a lot of hypermarkets, Tesco, We have Giant and Maidin and so on. So a lot of Malaysians will tend to visit the hypermarkets to get their food because it's probably cheaper and you probably can buy other stuff as well at the same time. Of course, some people will go to the market and buy their fresh produce and so on. And when you look in the internet and so on, they will always talk about our animals, especially like chicken, poultry, or your cattle and so on. They're being injected by hormones and so on. So how sure are you the food that you're getting is actually really fresh, unless you're getting kampung chicken or you yourself rear your chicken or your fish? And then you're talking about vegetables. We're talking in an era where people want to get maximum produce with minimum amount of investment and so on. They want to grow tomatoes as big as balloons, or even carrots as long as cucumbers. You don't know. So, and the hybriding. I just heard, a colleague told me that day that somewhere they're producing durians without the duri. It's supposed to be as round as a pomelo and it's supposed to be a durian.
Yeah.
Because of food technology. Okay. And let me ask you another question, Vance. When you go to a restaurant and you're paying 20 Sing dollars,
Okay.
you want value for your money. So you're not going to, accept a small portion of, a kind of a patty of, let's say, fish and chips. You want $20 worth of that and probably more. You want your accompaniment of soup. You want your dessert also thrown in, and you want your bottomless drink as well.
Yeah.
So this is what we are talking about. Food
The drink have to be full of sugar.
Yeah.
Then it will go well with the food, right?
Yeah, you're right.
We can't be equating that, but it is how it is. Right?
No, because we know that this is the way that food is prepared. You got to increase the salt in your food to make the sodium go up. And to mask the sodium in the food, you add in sugar, which are high in calories as well. And you package it in a deal that is probably about 20 ringgit. Malaysia is quite expensive, but when you have a combo like this, people are willing to pay for it because there's value. But the question is, does it really mean value in the long term of your health? So when you talk about food economics and you talk about health economics, it's two different things, and it's a very gray area. So people are, I'm not saying exploitation for profit, but they are going for profit. Whereas certain people who choose to accept this are doing it because of either they are aware and being ignorant about it, or some are really innocent. They just don't know and they think they're actually paying for value. That is, you're buying more for what you're paying for. So this is another way of looking at what is happening in the world now. Now, when you're talking about exercise, there's now Vance. During the COVID period, of course, most of us were indoors. In Malaysia, we had something called MCO, so movement control order. So we couldn't go out. So most of us were at home. But if you think about it logically, that would have been the best time for you to actually lose weight, because your food is under your control, and you being a fitness trainer, there are enough of material in the house for you to do your sets and your workouts and all the thing. You can do push-ups, you can do pull-ups, you can do back rest, you can use water bottles, and so many things you can do. But people choose to just wait and say that we can't go to the gym, we can't go exercising, we can't go running, and so on. So it's the way of how you look at things.
You talk about push-up. I just managed to saw this while ago. You were doing push-up as well. So maybe you want to talk about that. What was exactly what you did?
Oh, not bad, Vance. How did you get that?
You are wearing a mask and then you're doing a push-up as well. So you are leading by example as well, doctor.
No, actually, this was a push-up challenge by my colleagues in Japan.
Okay.
They started this healthcare professional push-up challenge.
Okay.
So it became viral for a while, and then you got surgeons from Thailand, from Japan, from Korea, and all over the region. Even my colleagues in Malaysia as well, who had to do push-ups and pass it on to the next guy. So it's something like pay it forward, lah.
So this is how you keep yourself fit in your duty time, right? When you have, let's say, about 20 or 30 minutes time, you go and do a push-up and then get pumped up.
But I'm very fortunate, Vance. What do you think of my push-up? Do you think it's okay?
I mean, to be very honest, you are doing it, I think, and it's also elevated, right? And you didn't put your feet on the ground, so you actually elevated a little bit. So it's a big challenge as well. So yes, you did good there.
Wow. Okay, coming from a expert fitness, I'm really happy.
But I think the next one you should do a flying push-up, with different claps. I'm trying to add more salt and sugar.
No, I like that. It's a good challenge actually.
Okay. So, okay, what you are saying about exercises is true because you are leading by example as well. And,
Yeah,
just push-ups, like, you don't need weights or even
yeah,
you need to go to a gym. You can just do it at home. I think that
yeah,
is the popular right now. I mean, every one of us have turned the house into a gym. They're using
yeah,
water bottles, they're using books, chairs, tables, benches, sofas. Everything can be done in the home at during this period of time. And people are
yeah,
getting more suit to it, I mean,
yeah.
for those who not to, sometimes the luxury is not there to go to a gym because of, financial issues. They can
Yeah,
do it at home right now. And there's a
yeah,
lot of videos and lots of virtual are coming in as well. So there you go,
yes,
doctor.
correct. But one thing, Vance, I must tell you,
Yeah.
if you follow Simon Sinek, right, you follow his articles and so on. What he says is really true. Humans, forgive this one, but humans are social animals actually.
Yes.
It's how we were from the beginning. So if you ask me, in terms of motivating yourself and keeping yourself motivated, for you and for me is different because we are in that line. Like we shared earlier as well. I've always loved exercise and I'm really into it. But for us to maintain it, Vance, I still feel the best option would be for a person who is not exercising regularly and really wants to get into it. For them, it's good to join a gym because
Yes.
you have a community together.
Yes.
You hit the gym 5:30 in the evening. You meet your mates there. You all sit down and then then you spar with each other, or you all get on the treadmill and so on. So I feel for people who are not used to exercising and so on, it's good to go out. Either you go to the gardens and then you have a community there, and then you all jog together.
Yes.
This makes it more fun and more happy, and it's good to do it with your family and so on, right? that's
Yes.
that's what I think is a better option.
Because of the culture and a community that you build, even if you go to a gym, because you know that your friends, even your loved one, husband and wife, or
Yes,
a brother,
yes,
so it becomes like a lifestyle. Like, every day, every morning I wake up, the first thing I need to do is brush teeth, and then I need to
yeah,
go to the gym. So it becomes a ritual that you need to do it on a daily basis or weekly basis, right? But also when we talk about exercise, doctor, I think, at this point of time, I mean, I'm sure you have seen as well, virtual fitness is right now has picked up never before.
excellent.
Even I myself also been forced to do virtual at this point of time because
Yeah,
I
yeah,
was, planning in a way that, rather than you stop until the pandemic over, until a
yeah.
vaccine comes out, and we never know which category we fall into. So virtual fitness are kicking up. So people are getting more health conscious right now. I can see more people exercising than ever before in the past 10 years.
That's great news, Vance. That's excellent news.
Yeah. And doctor, if
Do
you
you, do
also
you do virtual? Do you do virtual training from Singapore to Malaysia?
I mean, virtual is just open up. So we just have a link,
Okay.
and if you have the link, and then you come into our training space, and then you will do like a group session or either a one-to-one session. So it's all just about the link that we actually provide. And every weekly once, we're also trying to do it like open up for trial, people to come in and try it out. So basically, it's just to get you exercise, to move your body, do simple stretches in the morning, because everything is become slow down in your life at this point of
Yeah,
time,
yeah,
even
yeah,
how
yeah.
how rich or how not so affordable you are, whatever the situation, you have to be in that situation at the moment. So I think this is the best time to maximize your exercise regime, get into an habit.
Yeah,
But doctor, like, I was saying, right, even people are starting to exercise. One is a
yeah,
good thing is that over the past 100 years, since the
yeah,
Spanish flu pandemic and H1N1, MERS, SARS, Ebola came in, there was not much of an issue. People quickly turned back, a vaccine was found, people move on with their life.
yeah,
But with COVID-19 is a bit different. It's changed people. Made people to think even more deeper, and that's
yeah.
why they're putting the fitness as a main priority.
Yeah, and I think we are more aware. If let's say the pandemic, like the Spanish flu, happened now, as you know, the deaths were more than a few 100,000, almost a million over, right? In ours, it is still quite high. Of course, it is quite high, but still, a lot of countries have taken steps to try to curb the spread of it. And of course, the situation now, Vance, we're talking about world travel with flights that are flying in and out here and there. The disease could have just spread out, to maximum effect. But luckily, because of lockdown and so many steps, a lot of countries took the option to stabilize it, lah. Yeah.
So, doctor, I'm gonna give you a very difficult question. Probably you might not even find these kind of questions in your MBBS or even your medical exam, right?
I'm already getting nervous.
And you got to understand this is live streaming, yeah. So yeah, doctor, I'm sorry, I just got to ask you this. Wasn't planned for.
Yeah.
Every 5 years or
Yeah.
every 6 to 7 years, a virus is coming in, and especially COVID-19 came in and hijacked everyone immediately. What assurance we have, or what we, I mean, of course, we don't have any assurance. What happens if another virus came in the next 1 year and hijack us and our body can't able to take it? Are we prepared, or our immune system, is it prepared? What are we going to do? Is it something that we need to exercise every day to keep yourself fit, or you take vitamins and you be very like a robotic kind of lifestyle, wear mask, you take precaution? So what is the answer will be?
Yeah, I think that's a very tough question, Vance. You know why? Because when we're talking about human beings now, we have, I think you as a fitness trainer, you're aware of the concept of muscle memory, right?
Yes.
So when you do a certain exercise, you already know, okay, I can take that amount of strain and so on. So similarly, genetically, we have something that is called our immune system, which has its own memory. So when you have a certain infection from a certain organism, especially viruses, you can handle it. But the problem is the virus also mutates, You're probably seeing COVID-19 now, but next year probably you see COVID-20, COVID-21. We don't know what's going to happen. So when they develop a vaccine, the vaccine has to be effective for this COVID-19, 2021, and so on, as much as it can cover. So that's why they have to go into the genetic background of the virus itself and look at its formation, how it develops, and so on, and try to find an effective cure. And of course, a part of how we develop vaccines is that we inject ourselves and we develop immunity towards it as well. So the problem with this, I think, don't get me wrong, I'm not an expert virologist or anything, but the problem is to get this vaccine at this moment. Vance, if you see, we all lived in the 80s, right? If you remember in the 80s, when the HIV epidemic actually came,
yes.
I was, 79, 80, 81, 82, I was in a primary school. We didn't know much about it in Malaysia, but suddenly, in 84, during the time of Live Aid and everything, Rock Hudson, and, at that time we knew, HIV was there. It became something very big. And of course, when Freddie Mercury got it and all that, it became, everybody knew about it and so on. But that was 1984 when they isolated the virus and so on. Do you know when they actually got the vaccine, or not the vaccine, but the treatment for it, which is a drug called Zidovudin? It was almost 10 years later.
10 years.
Yeah. So we're talking about 10 years duration. And now we have COVID that just came in December last year. They've already mapped up the genetic makeup of the virus itself, and they're looking for a cure for it, a vaccine and so on, which is, it's tremendous in the time frame that they're doing it. And they might do it by end of the year or next year, but still it's amazing. And this is because of technology, supercomputers, and so on. And you have so many labs around the world. But to answer your question, whether another virus comes in the future, well, that's, it all depends on God lah. If it can happen to anybody. So like you said, just be positive, keep yourself healthy, keep yourself in a good weight, eat good food, exercise, and leave the rest to whatever it will be.
Well said. Good. Because that's, it is unpredictable. And I think one of the most important thing that we don't live in the world, we live within ourselves. Yes. And that is the body that is in the earth, right? Most of the time say we live in the world, but no, if your machine is not working well, whichever planet you are not able to function.
So, you look like a fitness trainer, you look like a sage, you have a lot of words of wisdom.
I get all the time right now, so maybe perhaps I might have to change my profession slowly.
Yeah, they might call me Swami Vance.
Thank you for that. I know, doctor, that you also have a video to show us, but before we go to the video, another very difficult question to ask you.
Yeah.
Is bariatric surgery safe? Because I'm asking that is because I know there are some cases, I don't want to mention which country because that's the best way to talk about it. Yeah. There's some cases that happen otherwise where it wasn't successful and mishap, death. So how safe it is, or is it not safe?
Okay, yeah, because that's the topic of today's show. When you talk about bariatric surgery, right? People think that okay, bariatric surgery is something very new, and it just came into fruition maybe in the last 10 years or so. But in actual fact, the first bariatric procedure that was done was way back in the 50s and 60s, and it was done by open surgery. Okay, that means they used to do a big surgical incision, and they would have done the procedure, which I will show you later. And they did this as a form of a weight reduction surgery for very critically ill patients. But it didn't really take up because of the morbidity involved. Imagine a big surgery, patient is about 100 over kilos. When they recover and everything, they're already probably very severely ill and so on. So it didn't really take up. But what happened, Vance, was that in the 90s, suddenly there was a shift because of the development of laparoscopic surgery. Okay, when you talk about laparoscopic surgery, most of the incisions that are made are the size of one finger for you to put in an instrument like a camera. And instead of putting my right hand and left hand, we use instruments. And we are able to do a complex surgical procedure by using these devices. And these devices cost, it's also thankfully to the industry, the development of technology, staplers, energy devices, camera, telescopes by Olympus and all these companies like Stores and so on. So all this has caused tremendous development in technology, and of course with a lot of research, with a lot of skilled surgeons, my bosses and my trainers and everything, and they have brought bariatric surgery to where it is today. Now, as we know, when you're driving as a driver, when you're driving your car in the beginning, you tend to be very unsteady, unsure, and you're not sure of how you're taking it. You're basically training out there. Vance, no one talks about it. When you're talking about a guy who just got his license at 17 or 18 years old and he's taking his car and going, he may meet in one or two accidents, but it's forgiven because he's just started and so on. But we are not so forgiving with surgeons who are starting in their career, training and so on, because the standard is very high. So when we're talking about any complication events that happen, of course, this is early in the learning curve. But most of the centers which are developed and are doing bariatric surgical procedures as a routine and have passed the learning curve have very good outcomes. So what are the complication rates? I would say now in the expert hands, in the best centers, they are probably just as the same as removing a gallbladder or even doing a knee replacement surgery. So that is what we're talking about, the complication rate, okay, which is very low, probably less than 2 to 3%. But having said that, when I take the analogy of driving your car. When you're driving Singapore to Malaysia, you make sure that the road is clear. You're not driving in a time when it's jammed or so on. And then the weather is good. You have clear skies. It's not in the dark, raining, heavy. And of course, the driver who's driving the car is not under the influence. He's well rested, planned very well. All of these circumstances favorable for that, the complication rate is very low. Most of the hospitals will employ very good staff. Most of the consultants are well trained. We take precaution in preparing the patient well for surgery, and the outcome is tremendous. Having said that, also there are some entities of some complication that may happen, but it is very, very low nowadays. So to put it in context, I think nowadays we are, comparing to when the complications happened before, probably now you're seeing a much, much less rate of complications in bariatric surgery.
Doctor, when you talk about that, of course, there's always a risk when we are talking about, surgeries and even whatever surgery that we're going to go for. But is it the option that someone goes for this bariatric surgery? Is it because they are at a stage where blood pressure, diabetes, atherosclerosis, or even cholesterol is high, at a high risk? Will there be a time where the high risks are the one who are going for this option, or is it that someone who was like the earlier stages and said, you know what, I got a wedding coming up in a 1 year time, I need to lose 20? So is there, because we do not know what is the kind of people that we should go for, is there a high risk, they want to do it because for their health, or is it they want to do it for the aesthetic look? What is the number of people are coming in?
Excellent question, Vance. I thought you put it very well. Because when we're talking about bariatric surgery, I gave you the statistic that's now about Asians and their BMI being more than 27. But we do not offer surgery for BMI more than 27. It has to be more than 32.5 surgery. if you're having comorbids, that means you're having, like as you said, heart disease or diabetes or hypertension and so on. And if your BMI is more than 37 without any of this disease, then only you're eligible for bariatric surgery. So it's quite high. Imagine 27 and 37. So as you said, if you're just going for a wedding or you want to lose your weight and so on, we will not advise surgery for these individuals. You're only eligible in the criteria if your BMI is more than 37. But on the other hand, if you have life-threatening diabetes, hypertension, you are on the way to developing kidney failure and so on. This may be in a very late stage of the disease events. Your risk in doing surgery at this time may be even higher than a person who doesn't have all this disease. So to take it into context, we always say try to do it in a period when you are not going to experience more than necessary complication. If your complication, you're already on 2-vessel disease, you got a stent inside there, and you're on multiple medications and so on, your risk is actually going to be higher doing the surgery.
Yeah.
So that's why we work very well with our cardiology team or our physicians and so on. So I work in a tertiary center where we have all the backups available, ICU, HDU, radiology and everything. So for us, we can handle this kind of cases. But like I said, the risk of mortality is always there, and the risk of morbidity complications to happen in these cases could be slightly higher.
Understand. And I know that I'm also aware that you're going to show us a video
Yes.
on the procedure part. Maybe can we dive into that as well, Doctor? To have a
Sure.
better view of that.
Yeah. Because I like I shared with you, I thought maybe it's good to explain it visually rather than just talking about it, Vance. Can you see the video? Can you see the picture?
Yes, I can.
Yeah, so I'm going to talk first about this procedure called the sleeve gastrectomy. Okay, this is a procedure where we actually resect the stomach. This is called a restrictive procedure where we divide the stomach, as you can see here, in the shape of a banana. Okay, so to make it even easier, I will show it in the form of a video. Okay, like I mentioned earlier, most of our surgeries are done laparoscopically, where we use these keyholes or incisions, and these are instruments that are called trocars. Through this, we insert a camera, my right hand instrument, my left hand instrument, and one for the assistant, and another to actually retract the liver. Can you see this, Vance?
Yes, I do.
Okay, so the esophagus is in the top here, and you can see the blue color is actually your food that is coming in. It's moving around the stomach, getting digested, and as you can see, it forms chyme, which is yellow in color and gets digested and goes into the small intestine. Okay, now this area here is called the pylorus, and about 4 centimeters from here, we use titanium staplers and we cut the stomach in the form of a banana. So you can see the resection is already done. The stomach portion on the right hand side is removed. It's a permanent procedure, and this reduces the size of the stomach, the amount of food that is taken. Now you might be asking me, Vance, why do you do this? Well, the reason being, if you can see this upper portion of the stomach on the right hand side is where the hormone ghrelin is actually formed. Okay, so this hormone is actually very important for you to feel hungry. So the amazing part in surgery is that once you remove this portion, you actually lose that feeling of hunger. And the shape of the stomach that is created will result in the food transiting the stomach at a very faster time. This is the area that is called the pylorus, which releases the stomach, releases the contents. And as the food empties from the stomach, it stimulates another hormone called GLP-1 that goes up and makes you feel full. So that is why people who undergo this surgery will feel less hungry, will feel more fuller, and of course the amount that they eat is lesser. So that's why the surgery actually works for them. Is that okay, Vance?
Yes, Doctor.
Yeah. Okay. I'll go to the next video that is very popular in the world right now, which is called the gastric bypass. Okay. So this is the formation of a gastric bypass. As you can see, the stomach is divided. We do not remove the stomach anywhere, but we just do something that is called a bypass, which is called also in Malay pintasan. So the stomach is connected to the intestine, and the intestine below that is connected to each other. I will show the video so to make it more interesting for our viewers to understand. Is it okay, Vance?
Yes, please, Doctor, carry on.
Okay, so we'll go back to the anatomy inside the stomach. This time we use the titanium staplers and we divide the stomach into an upper portion and a lower portion. This upper portion will be connected with the distal or the end point of the intestine and brought up to join the stomach. So the food contents will enter directly and go directly into the jejunum or the small bowel. That is in blue over here, bypassing this proximal part of the intestine, which is called the duodenum. The yellow color pancreatic juice, intestinal juice, everything will come to interact with the blue food content, and digestion happens much lower down. Now, you'll be asking me, why do we choose this configuration? One, because it is restrictive, it reduces the amount of food that you can take. Secondly, the food will go in and trigger distally into the small intestine and stimulate the same hormone that I was talking about earlier, the GLP-1. And there is a mechanism for this procedure to actually treat diabetes, Vance.
Okay.
Because if you can't see it in the diagram, but if you can see my cursor here, this is the situation where the pancreas will be. Now, when the food content bypasses this area, there are some elements in the yellow place here, which are called as incretins. And these elements will cause your insulin to go up normally. So as you know, diabetic patients do not have insulin enough in their body. But because of this procedure, your insulin in your body will go up by itself because of this incretin effect. So that's why for my patients who are diabetics, I tend to choose this procedure as an option for weight loss as well as diabetic remission. Okay.
That's very interesting, doctor, because I've not faced that the situation will be coming like where you do this to, even for diabetics patients as well. All we know is CT. But
this bariatric surgery for diabetics is something that is called as metabolic surgery. So we are talking about, I wouldn't say cure, Vance, okay. What we are talking about is diabetes is a disease that happens in your 50s and 60s because your pancreas will wear and tear and actually basically go down and basically become a diabetic in your 50s and 60s. But what is happening now is because of insulin resistance, because of too much of food, obesity, and so on, diabetes is happening at your 30s and 40s.
Yeah.
So what we are doing with bariatric surgery is just pushing the set point back to where it's supposed to be, losing weight and pushing it forward. So individuals will tend to think that sometimes it could be a bit drastic, but if it works for you and it achieves the goal to postpone diabetes, to give you the glycemic control and so on, then this might be an option that would be suitable for you.
Very nice video, doctor. I mean, you showed us the anatomy of it and makes us understand, and also for the viewers to, because this will be a recorded version, so anybody can come in and watch it again. But doctor, you also, I mean, of course, you do bariatric surgery as well as you're also an endocrine specialist, right?
Yep. Actually, I did endocrine and breast surgery as my initial subspecialty, and then subsequently branched into bariatric surgery.
So you've been doing endocrine since that's one of your practices that you do also at the moment?
Yeah, in fact, I love doing thyroid surgeries. I just did a parathyroid yesterday. For those who have a very severe hypercalcemia and renal disease, there's a condition where they develop something called secondary hyperparathyroidism. So the surgery is indicated for them. So I work very closely with physicians, Vance. So basically, colleagues, we work together. We do not, just pull a patient and say, okay, you are fit for surgery. This is what I say, you just follow. We work as a multidisciplinary team. We have a dietitian, and we also have our own physiotherapists as well, Vance, and fitness trainers. And now we're getting the message across. So there are different types of modalities around, and I think we as medical practitioners as well as you as fitness experts can work together, and all of us should give better options for our patients, because in the end of the day, we care about human life and we want them to be as better as they can, right? Maximize themselves rather than give them some form of quick fix help that probably they don't need actually.
In fact, doctor, spot on. What you said is spot on, because all these are necessary to push the numbers even lower. Because right now, if you look at it, myocardial infarctions or diabetes or even cholesterols or even a lot of other illnesses are coming below the mark of 40. Usually, when we talk about myocardial infarction, it's always happened at 60, 70s, 80. Okay, time to go. But right now, it's cases like, 30s, even early as 27, 28. MI is coming in, and, diabetes are coming at 35, 37. Is it one of the reasons because of our lifestyle and the food surrounding us? And imagine lots of alcohol, just abusing the body until the body gives up so much earlier than what is supposed to be in the next 20, 30 years.
Yeah, actually, I think you hit it on the nail, Vance. Basically, we're not taking care of our body. Basically, we tend to, it's easier for us to shift the blame. The environment is not suitable. The weather is raining today. I can't go and exercise. I don't have a gym down the corner. I can't afford it. There's a lot of things that, how many of us who probably will say that, okay, I can't afford a gym, so today I'm going to cycle to work. Because we don't accept it. In Malaysia, Singapore, it's so hot outside here. How many of us, it's not like cycling in UK or something, so they're not going to do it. But at the same time, if you know very well you're already obese and you're overweight and so on, you need to exercise. You need to do in your what do you call it, your 10,000 steps. You got your Fitbit and all that, and then you buy it, but you don't use it. You don't work the body. So it doesn't work, Vance. So that's why I always say, you got to get yourself in order. If you need to, then consult a good trainer like Vance, and get a schedule or something done and work towards it, because that's the only way that you're going to see some positive thing in your life.
Doctor, because like what you mentioned as well, I think spot on as well. Because the lifestyle surrounding us, work, stress, environmental, food, and we tend to work early in the morning and go back late at night, and we just misuse our body like a machine. And I think we started to realize it's not the other way around when this COVID. I think COVID is actually I don't say it's a good thing. Definitely, it's not a good thing, but it taught a great lesson. And of course, it shouldn't happen. But everybody just woken up from their dreams, or even from their real life. Hey, it's time, because you can see everything is slowed down.
Yes,
those who are working at 140 beats per minute, now they're all working at 60, 50. Tend to have more rest, more. But of course, other issues just comes in, right? The financial issues, the economy issues, recessions as well. It's more pressure. Hopefully all these things just goes away quickly. Hopefully a vaccine should be found soon, so that the nation has salvation.
Exactly. That's why I say you seem to be more of a philosopher rather than a fitness designer. So but what you said is true, because even for me, early this year, so I think towards late last year, because I just moved to private practice and so on, the work was hectic, and you tend to take things for granted. So when the COVID came along, we were actually hit quite badly. We were like scaling down. We were offering emergency services and so on, but we cut off our elective list and so on. So I had more time on my hands, and I think that was the time that I really looked at within and saw that actually I didn't have my life in balance, and I actually started working out, and that actually carried on into what was going on naturally, and currently it's kind of a routine in my life already. So I get up about 5:30 in the morning, and I do my labs, and I do my exercises and everything. Then I go to work, and it seems to be more paying off, I feel. And at the end of the day, you have a great conversation with a great friend, and unfortunately, I don't have my coffee here.
But trust me, once the COVID is finished, I'm coming there.
Sure, man.
Something
for sure. Yeah, sure.
Doctor, I mean, for the past 1 hour, I mean, thank you for your time. I mean, as a surgeon, you might be busy with other stuff or spending time with family, but you took your humble time, and you want to share and showing us a video. I mean, you've given a bigger spectrum of whole holistic, because you talk about diabetes, you talk about cholesterol, we talk about the food, we talk about lifestyle, the pre and post. I think it was a very great conversation, because we can keep on going for another 1 hour, but I think for everyone. But that one, I think we keep it when COVID-19 finishes, then we should meet up. But if I'm just going to ask you one last thing for the day, advice for the day, I mean, which is the golden words, so that you can take back at this point of time. I'm sure everybody's just at home, spending more time and time on social media. So even good recorded versions for them to come back and see, because it's very fruitful.
Okay. Amazing like you, Vance, because you always come up with some funny question that really puts me on the spot. Okay, but great. Let's see. I think you asked a very prudent thing lah. Let's talk about me lah as a bariatric surgeon. One thing that comes to mind was last night. Last night, I think I was watching Batman, The Dark Knight. So if you look at Batman, I mean, it sounds kind of funny, but there wouldn't be a need for a Batman or anything if there was no crime. If Joker wasn't there, he wouldn't be there. And that was the whole gist of the movie as well, right? When there's an anti-hero, the hero has to step up, right? So I feel, for me, bariatric surgery is here because there's a reason that we need to do it. The obesity epidemic is spiraling out of control, and it is happening in our lifetime, Vance. We have seen it from the time when we were kids. How many of our friends or people around us were obese? I don't remember any of our teachers were obese, Yeah, but now it's different. You look left and right. So the environment has changed so much, and it's time for us to step up. Health professionals, fitness trainers, dietitians, people who have this innate nature to want to help. I think we should step up and we should be the voice, and we should say something that we're passionate about. We want people to be well. If I do not need to do surgery, I wouldn't do it. I've got other surgeries that I can do. I can do endocrine, I can do breast cancers. It's okay. We do not need to do bariatric, but right now there is a need. And just like Batman, all of us need to fill our role to do the right thing. So my advice for the day for all our viewers, be a hero. Just do that little thing, try to live a happy life, get your family involved, exercise, eat healthily. These are the simple superhero steps that you can take for your family, your friends, your loved ones, and so on. What do you say, Vance?
I'm going to watch Batman tonight. I'm definitely going to watch because it shows me one thing that I have not watched properly. So Batman tonight is a must. Because then I will be able to know what is it all about. So Batman tonight.
I don't know why I use that analogy, but I think maybe because I remembered it.
It's going to be entertaining, and as well as a good story behind. And see, that's the thing, right? I mean, you watch the movie, but the message, of course, it's for leisure and of course for entertainment. Yeah. You got the message and you shared with us. So I think it's not just the movie itself; it's the more meaning and how you want to interpret it and use it for our own self. So well said. Thank you so much.
Perfect. It's everything that happens in life is how we take it, either positive or negative. If we look at COVID as a period in our life where we're suffering and all that, then of course that's what's going to be. But if you look at it as a point of learning, as a point of taking proactive steps and all that, then I think that is what we will take home.
All right, doctor. Thank you so much. I'm going to drive to Penang very soon once the borders are open.
You're most welcome.
Go for some healthy foods. Healthy food, okay? We should talk about. But thank you so much. I think it's a very in-depth session. I think we're showing the videos. We talked a lot, and I'm sure because if you can see, there's a constant flow of viewers constantly watching us. So thank you so much for giving us your support and staying. But don't forget, watch the Batman tonight. Batman. By Dr. Kiru. Thank you, Dr. Kiru, so much. We will stay connected, and I will be driving there for sure very soon.
Okay. Thank you so much, man.
Thank you so much. I'll catch you soon.
Cheers. Thank you. Been a pleasure. Good night, everybody. Take care. Bye-bye.